This lens can be adjusted after it's implanted in the eye during cataract surgery, making it truly one of a kind. You want to find out more about the light adjustable lens? Keep watching. Hello everyone, I am Dr. Rupa Wong, board certified ophthalmologist, and on this channel we talk about eye surgery, eye health, and a little bit about my life here in Hawaii. So if any of that interests you, make sure to hit the like, follow, and subscribe button. And to that end, about my life in Hawaii, you'll notice I am not filming where I normally do. I'm filming here in my office because I have a special guest today. I am a pediatric ophthalmologist and adult strabismus surgeon, so I no longer do adult cataract surgery. I stopped operating on adults for cataracts maybe about 10 years ago. I've been in practice now 15, 16 years. And the reason I stopped operating is because my husband does all of the adult cataract surgery. He is a refractive and cataract surgeon, and he's just better at doing this because he was doing more of them. So I wanted him to come and talk about the light adjustable lens. This lens is not approved for use in kids, so though I do pediatric cataract surgery, it's not something that I've ever implanted or really know that much about. And instead of just me asking him questions, I figured let's ask him the questions together. So if you were researching whether or not the light adjustable lens is right for you, we will go through it all today. Let's go. This is my husband, Dr. Jeff Wong. We run our practice Honolulu Eye Clinic together, and he is a fantastic surgeon. He did my parents' cataract surgeries. He did his own mom's cataract surgery. He's the kind of person that's meticulous and someone I would, of course, trust with my own eyes. He's been doing the light adjustable lens, and I think it's just a really interesting and neat technology. We've all been waiting for a long time for this technology to come out. So I figured I'll just ask you some of the questions. The light adjustable lens is considered a premium lens, right? So that means that it's not the standard lens that's offered during cataract surgery. So your surgeon will likely discuss all of the different options that you have for upgrading your vision so that you can read a little bit better. But what makes this lens so special?
By far, this is the most innovative intraocular lens on the market. It is the first time that we can adjust the lens after surgery without doing further surgery. In the old days, if there was some kind of a problem, if the lens power wasn't quite right, you would have to do a second surgery to adjust things, either LASIK or even replacing the old lens and putting in a new lens. Now that we have the light adjustable lens, we can adjust it after surgery with a simple light.
The neat thing is, to back up, if you don't know anything about cataract surgery, you can check out some of the other videos I have on that. But the first and foremost, your cataract is just a clouding of the natural lens of your eye. That gets removed during cataract surgery. We usually remove it with ultrasound power called phacoemulsification, sometimes by laser cataract surgery, which my husband also does. And typically he spends hours in this clinic when he's examining patients doing these measurements to be able to calculate the power of the lens that needs to be put in the eye so that people can see clearly after the surgery. And all of that's based on the different measurements of the front surface of the eye, how long the eye is, your glasses prescription, all of that. So there's a little bit of guesswork involved prior to having the light adjustable lens, right?
We are very accurate at calculating the strength of the lens that should be implanted into your eye, but it is still not perfect. And it is still something that we base on measurements done before the surgery. Then we pick the lens strength and you put it into the eye during cataract surgery. And you don't know exactly what you're going to get until after the surgery.
Now we've got a way to really just kind of hedge our bets a little bit, right? It's kind of like when I do adjustable suture strabismus surgery, that's basically what I'm doing too. I'm able to adjust the patient's eye muscles after surgery, which is pretty awesome. So you kind of have now the same technology, but with a cool laser light thing, which we don't have in my specialty. So this means that a patient needs to come back a couple more times post-operatively than you would normally, right?
So there are more visits, and those visits are very brief, and they are adjusting the lens just with a simple UV light.
And that's just in the office or in
an office.
In an office setting. So our laser is located in our surgical center, but for your doctor, it might actually be in their clinic or in their office. Now, is this lens, there are a lot of the other premium lenses let you see far away and intermediate, like computer vision, as well as up close. all different ranges, right? Multifocal lenses. Is this also a multifocal lens? Does it give you that same kind of vision? How does it compare?
So this is not a multifocal lens. The multifocal lenses traditionally have rings on the lens, allowing a patient to see near, intermediate, and far. This lens is a monofocal lens, which has a lot of advantages over the multifocal. With the monofocal lens, you won't get some of the side effects that you can from multifocals like glare, halos, and starburst. But the nice thing about this monofocal lens is it does have some range. And in fact, the newer version is coming out next year, which has an additional range. The results really are amazing. And, I tell patients it's kind of like target practice when you're doing cataract surgery. We're trying to hit the bullseye with the proper strength of the lens. And it's not always easy to get someone exactly on the bullseye. But the light adjustable lens allows me to get them onto the bullseye. The surgery itself is exactly the same. The biggest difference is you do have to wear some special sunglasses because the UV light from the sun can possibly change the shape of the lens. And we don't want that. So we use the dark glasses during the day. And then when you do the UV treatments, that's when the light will change the shape of the lens and get you right on target.
How long do they need to wear the glasses for?
So they may need to wear the glasses for about 4 to 6 weeks, but patients really have had no issues wearing them.
Is it more of a concern in somewhere like Hawaii where, right now we're in our office, it's brightly lit because of this huge window, which really probably has no ultraviolet light protection. So is it more of a concern for people here? Because otherwise, you would tell people just wear those glasses when they're outdoors. Do you tell them to wear them all the time here?
The first iteration of the light adjustable lens, it was pretty important to be wearing them all the time, even indoors. But they came out with a second version of this lens, which has a special UV coating so that it is less critical to be wearing them full-time indoors. Outdoors, if it's sunny, I would definitely be wearing the sunglasses. Actually 3 pairs. One is the dark sunglasses, one are the clear glasses, and the third one does have a little boost for reading.
So what is the adjustment like for someone? How long does it last? Is it painful? Do they have to be really still? Some people might worry that they can't stay still long enough for this or they're going to mess it up somehow.
It is really easy and it's quick. So it's in an office setting. The patient's eye is dilated. And about 60 seconds or so, the UV light is shined onto the eye. There's no pain or discomfort. Patients really do great with these treatments.
So you've been doing it now for a few months, right? And you're pretty happy. Most of your patients seem to be converting very easily. They come in wanting this lens, or you're able to talk to them about it, and to them it sounds interesting and they've been happy with it postoperatively.
This lens by far has the most buzz going on because patients really want that customization. They want to be able to test drive their vision, try out a certain vision, and then if they wanted something more, perhaps a little more reading vision, we can shine the light and adjust it that way. Or a little sharper distance vision, we can do that too. So it's an amazing concept.
I see. So it's not just about trying to hit the target more accurately. They are able to try out it's almost like trying a couple different pairs of glasses prescription, right? Before you actually settle on the one that works for you.
We've never had this ability, so this is phenomenal. With my colleagues, more and more ophthalmologists are interested in this lens. If you're an ophthalmologist and you need cataract surgery, which lens would you pick? This is more and more something that ophthalmologists are thinking about.
But I think it's important. So right now, I know that you do all of your own adjustments yourself. Now, for some
Correct.
people, an optometrist, not an ophthalmologist, someone else in the practice who's not a surgeon is doing the adjustments. But for you, that was important to do the adjustment.
For sure, especially the technology is new to me. I wanted to be doing everything, including the refractions to optimize the patient's vision.
That way you can really just know how accurate things are, where you need to titrate, where you need to change, moving forward, adjust, so that you get the patient the best result possible.
Exactly.
All right, there you go. The first ever time he's ever been on my YouTube channel. Maybe, yes, I think other than in the background. Voluntarily and in a speaking capacity.
And I'm a big fan of your show, Dr. Rupa. Thank you so much. I'm honored to be on it.
If you have any questions about the light adjustable lens, or you live in Hawaii, or you just want to come out to vacation in Hawaii and have this awesome surgeon do your surgery, drop them in the comments below. I'll also link to our website for Honolulu Eye Clinic, and you can send us an email or text us if you want to know more information. Thank you.